Hello, my name is Pauline-RN. Welcome to my channel. The title of my video is Skin Integrity Part 2, Questions and Answers, directly from RN NCLEX examinations. Please hit the thumbs up. Please subscribe with that black button. Please share this video with your friends, families, and classmates. My first question. Patient arrives from the ED. What do the nurse do first? Correct answer, measure wounds with tape measure. Measure length, width, depth. Document odors and color. Drainage is your correct answer. Your drainage can be serous, sanguineous, purulent draining, sanguineous drainage. Next question. What is your Braden scale documentation going to be? Your Braden scale documentation helps the nurse to predict patient's risk to develop pressure ulcer. When your patients are admitted, whether or not they have pressure ulcers, we have to document our Braden scale, which helps the nurse to predict the patient's risk of developing pressure ulcers. And this is documented every 12 hours is the correct answer. My next question, what is granulated tissues? Correct answer, red, pink, vascular, moist, rich, indicates good wound healing. A patient is bleeding. What do you do first? Correct answer is apply pressure. If your patient is bleeding a lot, for example, maybe I've seen the patient come back, had knee surgery, and the patient got up out of bed and started bleeding, a lot of bleeding. And we applied pressure, but just to let you know, when patient is bleeding so profusely, do not leave your patient, because sometimes patient can have surgery and they're bleeding from an artery and there's a lot of blood coming out. So we need someone at the bedside to apply pressure until the doctor gets there. Let someone else call the doctor or speak to him on the telephone. Next question is, patient is admitted to the hospital in the emergency room. What would the nurse expect the doctor to order? And the correct answer is expect an order for a tetanus shot is the correct answer. Next question. How do you do your skin assessment? What are you assessing for? Correct answer. We're assessing for edema. Edema can be 1 plus 2 plus 3 plus 4 plus edema. We're assessing for cyanosis. That's blueness of the skin. Check the patient's nail bed. Check for blueness. We're assessing for jaundice, yellow of the skin. Check the sclera of the eyes. Assess skin lesions, abrasions, skin tears. For oncology patients, especially patients with breast cancer, we will assess them for lymphedema. Next question, post-operatively, abdominal surgery, doctor orders an abdominal pillow. What is the use of an abdominal pillow? The answer is it supports the patient's abdomen while they're laughing, coughing, turning to the right, turning to the left, moving up and down in bed, getting out of bed to sit in a chair or to ambulate. It supports the patient's abdomen. If patient is in pain, when administer pain medications. Next question, what is the purpose of your abdominal binders for your patients post-operatively? The abdominal binders supports your patient's abdomen after surgery. For abdominal binders is a doctor's order. Do not remove abdominal binders after surgery unless it is ordered by the doctor. Do not remove abdominal binders post-operatively. Some of the abdominal binders become very bloody after surgery. If that happens, which is not all the time, have the doctor's permission to replace it with a clean abdominal binder with the correct size for the patient's abdomen. Abdominal binders must be applied while the patient is lying in bed. You place it behind the patient towards the abdomen. You snap it in front of the abdomen. Do not apply abdominal binders when the patient is standing. Next question is, purulent drainage indicates what? Purulent drainage indicates what? The correct answer, exudates, indicates colonization of bacteria. Usually, you will notify the doctor. The doctor will order a wound culture. When you do a culture of the wound, you will culture two separate areas of the wound, and you will send it off to the lab in order for the bacteria that is present in the wound to be identified. The doctor will order antibiotics specified to destroy that specific bacteria that is present in the wound. What are your interventions for your burn patients? Correct answer, NPO, IV fluids, pain medications. What is a wound vac is your next question. Correct answer, your wound vac is a negative pressure wound therapy using suction pump with tubing. The dressing is clear. To visualize the incision, for the tube, we do not allow any twisting, just like your Foley catheter. For the Foley catheter, we tape the Foley catheter after you insert it to the thighs. No twisting of these tubes. No twisting of these tubes. We have to be able for the drainage to drain out without twisting. If it's twisted, everything is gonna get clogged up in the tube. So this patient with a wound vac will have clear dressing to the wound so you can keep your eyes on the wound. You can see if it's very necrotic. If there's pus, we can see, we are able to visualize the wound, and it's from the wound there is a tubing that we tape to the patient's, most time is the leg maybe. We do not want any twisting or kinking of these tubes, and the tubes go into a drainage canister, just like your Foley catheter bag, somewhat similar, not exactly, but that scenario. The nurse's responsibility is to measure your output, document your kind of drainage. Is it purulent drainage from the wound vac? Is it pus? Is it sanguous, serous sanguous? Document. Any concerns? Call your doctor as soon as possible. Next question. What is whirlpool? What is whirlpool? Ordered by the doctor. The correct answer: whirlpool is administered by your physical therapist. In whirlpool, there's debridement of the wound. Before the patient goes to whirlpool, nurses are expected to administer pain medicines to all your patients before sending them to physical therapists, because it can be a painful experience. Next question. Why is a wound vac ordered? Correct answer: a wound vac is ordered to remove excess exudates and promote healing. Next question. For patients who are fresh post-ops, who do we delegate this patient to? And the correct answer is a registered nurse. She is the primary nurse for a fresh post-op patient, not a LPN, not a tech. The nurse is the primary nurse for a fresh post-op patient, POD 1, post-operative day, POD 1. First day, the patient is not out of the wood. So a nurse, RN, is delegated to a post-op patient, a fresh post-op patient, not an agency nurse. It has to be a registered nurse who is familiar with our environment, not a registered nurse who is fresh out of school on the floor for the first day. An experienced nurse who is familiar with her environment. What are the signs and symptoms of hemorrhage is this question. Correct answer: unexpected amount of bleeding is hemorrhage. Call the doctor stat. If the blood pressure, signs and symptoms of hemorrhages, blood pressure becomes low because patient is losing a lot of blood, and heart rate is elevating. If patient is having hemorrhage, bleeding, apply pressure. Call the doctor stat. This is an emergency. Some patients, if they are hemorrhaging, they will have to return to surgery. So please call a doctor immediately. We will check our patients' H&H for patients who have experienced any hemorrhages. If patients' H&H is low, expect your doctor to order a blood transfusion before the nurse administers any blood, and informed consent has to be signed by the patient, giving us permission to give them the blood. Jehovah's Witnesses, they will refuse, but you still ask them. The doctor is the one who signs the informed consent, not the nurse. The nurse is only a witness to informed consent. Please hit the thumbs up button. Please subscribe with that black button. Please share this video to your friends, families, and your classmates. Thank you. Have a good day.